So thank you everybody for joining this European Center for Clinical Research Training webinar. We're happy to be able to present Vincent Bayens, and he will discuss CRO management and oversight tips and tricks. One very important thing is everybody should be aware that we are recording this webinar so that we can put it onto the ECCRT website later so people can go ahead and use it. If you do have any questions, everybody is on mute. You will stay on mute, but if you have questions, you can put them in the chat room. We will have a couple questions for you, and the screen will pop up and you'll see a poll and you can answer the questions. We'll discuss that. And then at the very end, as I said, if you have any questions, you can write them in the chat room and I will go ahead and summarize them and ask them to Vincent. Okay, and Vincent Bayens is a pharmacist, and he was working in the R&D fields for the last 20 years. He has a PhD from the University of Geneva in pharmaceutical technology, and he's worked in a lot of different positions such as lab QC, non-clinical, regulatory in both biotech and medical device companies. And then since 2012, he's working as a global clinical operations EMEA position. So Vincent has worked with ECCRT before, and we're very pleased that he has agreed to present his tips and tricks on CROs management. Thank you very much, Vincent.
Thank you very much, Paula. I appreciate your time and your introduction. So I'm going to talk about oversight and CRO management. First of all, thank you very much for giving me this opportunity and welcome everyone. Thank you. Thank you for the introduction, your nice words. Indeed, you know, working for clinical operations has been for me a great experience, and you know, it's probably one of the topics where with my R&D experience, there is a big difference to what I did before. The big difference in clinical operations is that you work with people remotely, you know, like we do today. We speak, you know, and I'm sitting in Munich, and people are in Brussels or everywhere in Europe. And this is the name of the game today. So you need to trust the people you work with. You need to trust your CRO, and you need to manage your CRO. And that's a big learning for me compared to other positions I had in the lab. And for this, I spent a lot of time to try to understand how to do that. And I just want to go back to the title of the webinar, because it says management and oversight, and you see, it's not simply like you heard probably in the past. Management is a kind of vague word that may have different meanings, and this problem is well known, and there were a lot of discussions among the ICH and the GCP work group, and they actually updated the ICH guideline and provided a lot of additional wording about oversight of the CRO, and this is a very important thing to understand and to bear in mind when you work with a CRO. And also the second thing is this concept applies not only to sponsors but also to CROs. As a CRO, if you work with a vendor, you need to implement some oversight of your vendors as well, and communicate with the sponsor any finding that you may see. So that leads me to a first question I would like to hear. I'd like to understand. Are you working for a CRO or a sponsor company? This would be very interesting to know from the audience. Oh, most are for CROs. This is very interesting. I was actually expecting the opposite, because these concept has been so much, and probably because I'm working for a sponsor, maybe I was biased in this vote. I'm very happy I asked for it. That means the interpretation of this is that CROs are taking this very, very seriously, and they understand that their CRO management and oversight is a very important matter, and they are willing to learn from and develop from this by working with the sponsor. Thank you very much. There are a few things that a sponsor needs to understand before working with the CRO. I think there are a lot of homework that a sponsor must do, in my opinion. And of course, this is based on my experience. I haven't seen this in any book yet. But the first thing is you need to know as a sponsor and as a CRO as well, what is your core business? Where are you good at? What can you do in-house? What would you like to keep as a knowledge in your company? And then if you do that, you will be able to define what type of outsourcing model you would like to use with a CRO. That is for like the first thing, in my opinion. We should be focused on. This is very important for the next items, which are to invest in the long-term relationship. I think it's whatever the outsourcing model you're going to choose, try to invest in a long-term relationship with a sponsor or with a CRO, because this is in the interest of everyone to see the long-term and building trust in a relationship. And then I would like to touch a word about the oversight revision 2, which has been kind of revised by the new ICH, and which brings a lot of new light on how we work with the sponsor and how a sponsor works with a CRO. So typically, as a sponsor here, I'm going to talk as a sponsor for this slide. It is important to know what indication. Of course, you know the indication, but that means what is competitive environment. If you start a trial, you need to know what you know. You need to understand what is your focus, what is the type of population you want to target. And this has an impact on the type of course, of a drug you're dealing with. Is this a rare disease? Is this an orphan drug? Because this is going to impact the enrollment and the plan you will need to develop with a CRO or alone if you decide to handle some countries, alone on your own. And the third thing is the countries. The countries is in my experience, it's not only based on where do you find the best enrollment. It's also where is the business for a sponsor. It is an important question. As a CRO, you may ask, where are your most important countries? Is this the top 5? Do you have a new business in Russia? Do you have a business in Asia? This is important to understand where you go in terms of countries. And then you will be able to understand where are your patients. Are the patients in these countries or not? And then build contingency plan to increase your chance to find the patients at the best locations. And yeah, of course, the timeline and the budget will be impacted. But when I mean it's not only about asking a ballpark to a CRO and give me what you know and give me your experience, like a typical bid defense meeting where, yes, you collect in the background and the experience from a CRO. But I believe that as a sponsor, there is a lot to do to prepare this and optimize these interactions with with the CRO, and at a certain point you will be sharing this information with the CRO to make the best out of your study. And you may also need to understand where is your best CRO to assess a new tool, or maybe you need to work with a specific central lab who has a specific technology that you need, or maybe you need to implement one. So this is part of the business needs you need to understand, especially if these are your primary or key secondary endpoint in your trial. So that is about your core business as a sponsor. And then as a sponsor, I mean, I've worked with different companies, and it's always a discussion about what can we do in house, what can I have as a support to conduct a clinical trial. Can it be regulatory support? Can the team in-house participate in approving documents, communicating with the agencies? Do we have a pharmacovigilance database in-house that we want to keep? This is often a question. Also, some core functions in the sponsor can support the labeling. Maybe depending on the size of your trial, you need to maybe question your people as to maybe we can do that in-house. Same for QP release of your products. And yeah, clinical operation resources. This is also depending on the countries where you go, the size of the trial. You may need to outsource more or less, or bring in-house more contractors. And a very important point is about the quality of the preparation of the essential documents. Do you have medical writing in-house? Maybe if not, maybe the CRO can support, or you may have another plan to do that. And then a lot of QC activities depending on the sponsors. The CROs have, of course, their own QC abilities. It's important to check what the CRO has and what you can also offer. And finally, what available systems you have in-house, TriMaster File or CTMS, depending on the sponsor or the CRO. Of course, the CRO has this all in hands and ready. Sometimes the sponsor has in-house systems. It's important to understand what you would like to do before contracting with the CRO, and confirm with them what you want to do. You will save a lot of time. Now you have, assuming you have done your homework, and you've prepared, as a sponsor, what you want to do, what you can do in-house. I think this is where you can ask yourself as a sponsor, what kind of outsourcing model do you use most? And here we have people from CROs and sponsor. That's going to be very, very interesting to understand which type of model you have met in your career. Functional outsourcing, very interesting. That means, yeah, functions are outsourced. Not everything, but couple of, typically, I guess, monitoring or maybe data management, or we will see later some examples. And yeah, no one is doing in-house anymore, and I'm not surprised. This is something that was used in the past, but today, with the complexity of the trials we face and the regulations, it's very rare that someone would do everything in-house. And also, yeah, strategic partnership. I'm going to touch base on that in my next slides. This is also indeed something that I heard more and more for sponsors. And yeah, good to see full service outsourcing as well. Good. Thank you very much. So, now to define your company outsourcing model, like I just said and showed in the poll, yeah, in the past a lot of things were performed in house, and I was working in the 90s and on clinical trials, and yeah, we did everything in house, everything with paper, and everything was controlled. We needed a lot of people to do the QCs and everything, but we did it in house. Now the problem is that there are, there's more complexity. There is more demand from the authorities, and on the top of it, there is more digitalization of the job, and the evolution of the job has been very fast, and there's been a need to work with CROs who are specialized and can offer right away the systems and the SOPs that we need. And that is the trend. Yes, today there is completely outsourced studies model, full service, and also strategic partnership with the main CRO. Now, what I want to say here, I'm sure you know, but this is important to recall what I wrote in green. Whatever you outsource as a sponsor, the sponsors remain responsible. The ultimate responsibility remains with the sponsor as far as integrity of the data, protection of the subjects. So this is a very important concept, and this is why the concept of oversight was confirmed and updated in the revision number 2, which was recently released, that says the sponsor must implement an approach or a system to oversee CROs or vendors, key vendors' activities. And again, the CRO must do the same if the CRO has works with a vendor who is labeling the products, or or is doing data management or biostats. They need to implement such systems, and they must be able to show and share evidence with the sponsors or with any inspector. Now, I've taken some kind of examples, and of course there is an entire course on this at the ECCRT, and we will review this in much more details than today, including with workshops and examples and more deeper discussions. But for the purpose here is to give you a glimpse on of what is available, and what would be for you the choices that you have, and how to decide, right? So traditional, yeah, like we have one study, you do a study, and you're done with your study, and then you have another study, and you do the whole same thing again. Now today, of course, as you can understand, if you have several studies, you have an advantage to contract with a CRO, which are much more, like we say, preferred provider, or strategic partnerships, alliances, even depending on the size of your pipeline. This has an implication on the efficiency, on the cost, and also, most importantly, what I find is that you will be able, as a sponsor, to work with the same teams across your programs and your studies. And this is a message to the CRO, people working for CRO here. This is very important as a sponsor to know that you people are already on this program or on this or that study, and we're able to bring them to other study across the program. So I wouldn't say there is a preference according to the size of the sponsor. I would say that today everything is possible. Even small sponsor biotechs would be keen to discuss strategic alliances because they might have better control of their costs. So there's no rule for that. Everything is possible in my experience. Now I'm showing this. This was a survey done in Germany by big pharmas. I've put the reference below so you can check and read in details. This is public information. Uh, there were about 20. I think these were sponsors answering what type of outsourcing model they use, and of course there is a mix between this is global or at the level at the local level, but I think it's more internal strategy as to how you define a global product or a local product. But more importantly is to see that most of sponsor use a full outsourcing or partly outsourcing model. I was a little bit skeptical when I read unclear, so that means maybe to me the explanation was that probably the question was not well understood, because to me it could be like quite alarming if a sponsor doesn't know what kind of outsourcing they have. I've seen this in some situation, by the way, where you talk to sponsor and they mention that because they say, oh, I don't know which SOP I have to follow, therefore I don't understand what type of outsourcing model I have. So you see there's a lot of internal preparation and communication and work to be done if you outsource and if you take that decision, make it clear within the study group. So again, find the right balance according to your objective and your core businesses. I would like to go a little bit deeper here. Same publication. Do you apply a preferred provider model? Yes, in most of the cases. And you see that it could be with one CRO or more than one CRO. And the average is 3.1, so about three different CROs. I believe it has to do with the pipeline. If I've seen having sponsors having partnerships by indication, or sometimes it's by country or by region. So it means that if you hear preferred provider model, doesn't mean you must work with the CRO for all your studies. You have a choice still uh, to choose a CRO according to the indication, for example, or the phase of the study you work with, assuming you have the right contract in place, of course, to allow for that type of model. So I find it very, very interesting, and again, we will discuss this in more details. We have a 2 days program on this, but this is kind of a starting point I find very, very interesting. And here, even more interesting in the same article, you have in green, the question is, which type of services do you outsource? And of course, monitoring is the main service that is outsourced. We all understand that. Data management, medical writing, study management as well. I think it for me it goes a little bit together with monitoring. If it's hard to split, but it's feasible. It depends if you want to outsource the monitoring for a specific region or not, and the sponsor may keep the study management in-house. It's feasible. But more interesting is what is not outsourced or not so often outsourced. Pharmacovigilance. You see, it's kind of defined. We see as a core experience, a core function by the sponsor. I guess this is because, pharmacovigilance follows the life cycles of the product, and they have a sponsor have a system in place to capture all these events already, so they don't need to outsource this, although of course they need to get the responses from the sites, which is a big role for a CRO for a study. And the biostatistics as well, yes, sometimes it's defined as a core competency in a sponsor. I think it has to do with the strategy of the product, because the statistical plans are discussed with the authorities, specifically for pivotal trials. So it's not a majority of cases that this is outsources. And on the bottom you have medical review, which stands, I think, for like the individual data review, the ongoing aggregate review of the data. In my experience, indeed, this is most of the time conducted by people at the sponsor, but I've also seen, if you work with a CRO specialized in indication, in a specific indication, it could be that the CRO can offer this service as well. So I think very interesting data. Also, what are the criteria? And the sponsors, they look for quality. They look for quality before cost, and I think this is a good signal for all patients. In fact, I think this is very important, that the CROs and the sponsor are aligned with that. We want good quality of data, and we want delivery on time. Delivery on time might, it's a tricky word, because it can be from the CRO, it can be from the enrollment. There's a lot of meanings. But I think if you look at the graph, there is a perception that smaller CROs would deliver with slightly better quality and slightly better in terms of delivering according to the timelines. So let's move on to the relationship. And I've written long term. It can be a relationship for the study, but depends on the duration of your study as well. What I mean is, a study is a journey, and you need to work hand in hand with the CRO as a partner. Of course, you sign a contract. Of course, there are milestones, but real life is sometimes different, and the CRO and the sponsor need to implement a couple of things or systems that allow for a good dialogue between the different teams involved in the studies. So first, there is the risk management. The risk management is an ongoing work, and by the way, ECCRT has also an entire module on this, where we can dig into more details how to do that, what parameters to look at, and how to follow up on the actions. But most importantly is to share the information and be transparent. I mean, we work with people. If there is a feeling that the relationship with the site is not optimal, it's the obligation, I think, for the CRO or the sponsor to inform the partners and work together on how to resolve or prevent any problem. Same with vendors. It is very important to share KPIs, and KPIs are also important not only for the study or for the program, but also there are a visibility of the study for the upper management. I think this kind of information is very helpful for senior management, so that they understand these indicators, and they can see, okay, study is progressing, and we see where we go, and we have a visibility. And it can be technical, but it can easily explained in my view to the boards. And implement governance meetings. Governance meetings, you shouldn't wait to have 2-3 studies with the CRO. You can do governance meetings with one study. It doesn't matter. It's very important to keep a good trust within the team. Speak as one voice to the site, as I said earlier. Measure CRO performance and report finding. How to do that? There are different ways. I don't have the time to go into more details here. But this is again based on transparency. One of the indicators is the turnover, how much turnover you have in a CRO. That's a very important indicator for a sponsor. Identify your key factors to problem solving. Also keep relationship with business development people, because they are the one who will be willing to build a long-term relationship with you. This is, in my experience, very helpful to talk to them, to confirm, to reiterate the willingness to work together, or any problems that you have seen. And then lessons learned. Should be cross-functional and also transparency. The sponsor should do this homework, the CRO should do this homework, and then let's share together the learnings for future activities. I have one last point. About oversight. Again, I was telling you earlier, management and oversight cannot be separated. It goes together. And I think what triggered this oversight in the experience I had, and I have discussed with many other sponsors, it's often starts with a bad experience during an inspection, especially pivotal trials, where you realize, oh my God, maybe I thought that the information I got from my vendors were not, or from the sites, were not sufficient. And then, during a study, you realize, for example, safety of subject is compromised, or SAE is not reported on time. These are all signals that show I have to do something about my oversight of my subjects at the end of the day. And in case of wrong treatment allocation, for example, you need to take this very seriously, and question yourself about your oversight. Of course, we want to provide reliable results to support a registration, and this is between the line. That means you're probably going to be inspected, so you need to show some evidence. And you need to understand, control the risks for quality, cost, timeline for your management. You need to be able to tell them the timeline is respected, or I'm late, or the quality is questionable in this country, or the cost is higher, or I managed to save some costs. Oversight is also about the budget. This is a very important thing as well. Although, as I said earlier, quality should be your driver, in my opinion, in my experience. And then the new ICH-GCP E6 revision 2 that describes more details about risk management and oversight. Oversight. What is not oversight is micromanagement. It's not about sending an email every minute to ask this or that listing, or not kind of just keeping track of meeting minutes with the CRO. I've heard many times, like, oh yeah, I have a great oversight. I get all the minutes from my meetings with the CRO. Well, I'm sorry, this is not sufficient. You need to build up a real strategy, a real plan as to what do you check before you give to a CRO or a site, such as contracts. You need to check that there is a GDPR statement in it, and all these things that you need to track and think about it more than it's more than collecting meeting minutes about the issues with the site. Of course, it's good, but it is not the essence of oversight. So oversight is a process. This is a mindset that the sponsor implements to ensure that the CRO contract obligations are fulfilled, and it's based on experience with the set CROs and also with the product. You know, it's not only with the CRO. And for those who know about uh, uh, risk management, the oversight plan is based on checking, finding the risks, analyzing them, bringing a response if needed. Maybe sometimes you accept a risk, and then having a control and through a very transparent communication through the teams. How to develop an oversight plan? You know, I'm always a pragmatic person. It's very easy in a way that operational people are very pragmatic. They want to uh, follow a trial according to the timeline. So what do we do according to the timeline? You need a contract in place. You need to define your roles and responsibilities, or what we call the transfer of responsibilities in the US. Which SOPs are you going to use? And then you can start, or in parallel, you can start to develop a checklist. How do you approve the people working on your study? Who is going to have a final word on the selection of sites? Who is going to approve the contracts or the templates? Who is going to have a final green light to activate a site? Any co-monitoring visits? Any data review that will trigger actions, etc., etc. You have a lot of different possibilities you can choose. Most important is decide what action and document it. That's important. If you say you do something, document it and show it. That is all for my presentation in like 30 minutes, I believe. I'll be happy to answer any question or have any comments.
Right. Thank you very much, Vincent. Very interesting. We do have a question that somebody wrote in the question box, and that was related to that survey that you had shared with us. She wanted to know whether or not the responders to the survey with big pharma only, or it also included smaller biotech organizations.
I cannot give an answer for sure. I think there were big pharma. I remember Merck, Bayer. I think there were big pharmas. I do have that publication. It's public information. If you take the link, you will be able to retrieve that document, and it's very well explained. It's publicly available, and you can certainly check who were the main sponsor. I think there were more bigger companies in my, if I remember correctly.
Well, good, fantastic. So everybody, if you want that link, you can go back to the webinar once it's posted on ECCRT and look for that link. Thank you.
Okay.
A couple other questions. I think you'll probably go into more detail in the CRO Management and Oversight training on May 9th and 10th, but in general, do you have, because you mentioned CRO staff turnover, can you provide like a #1 simple tip for the audience of how to reduce CRO staff turnover?
That's a very good question. I think the thing as a sponsor you must do is to set your expectations. First of all, you want to explain a CRO. We want to build up a relationship. My expectation is that, in my case, for example, I asked to have senior CRAs or experienced CRAs, and to explain that we want people, or we expect a turnover that is acceptable. What is acceptable? I don't have a number here, but you will easily detect this type of behavior in a CRO. Most importantly, I think, because in real life, it happens. It happens, and you cannot avoid. It's very important for a CRO to have a proper handover of activities to the new joining, and the new joiner for sure should not be a junior, or there should be a kind of transition uh, between these two people.
Great. And we have one more comment. It's more of a comment than a question. And that was related to your discussion about outsourcing the pharmacovigilance services. Again, that might be differing between whether you're big pharma or not, and that more and more smaller biotech companies seem to be outsourcing pharmacovigilance more.
I fully agree. I fully agree because first of all, to implement a pharmacovigilance system, especially if you don't have a product on the market, it's very cumbersome, very costly. So I've seen many small biotechs outsourcing. It can be outsourced to CRO itself, or I've seen it to other vendors, other type of vendors who really specialize in pharmacovigilance. It all depends on what you want to do as a sponsor on the long term.
Great. I think that's all the time we have today. We've answered most of the questions. Vincent, I want to thank you again and remind everybody that you can see this webinar later on the ECCRT website. So thank you, everybody. Thank you very much.
Thank you, everyone.
Bye-bye.
Bye-bye.